Welcome and thanks for joining us. My guest today is Jianlian Fang, the Senior Research Analyst at RTI International. Thanks so much for joining us today. We are going to be talking about a very important topic that so many people deal with, and that is dementia care, caring for older adults in the U.S. But before we get to our topic, Jianlian, tell us about RTI International, the organization that you're with. What is RTI National for people who don't know?
Thank you. Thank you for the opportunity to speak with you on this very important topic. Happy to be here. RTI International is a nonprofit research institute. We do a lot of work for a variety of clients, including the federal government, local government, and commercial entities in the field of health, in many other fields as well. That's primarily what we do. For myself, I'm a healthcare researcher with a heavy focus on long-term care for people, older people, including people living with dementia and their family caregivers.
So this issue of caring for older adults, this is something that you do on a daily basis, or you work on a daily basis, it sounds like.
Absolutely. That's almost like my entire career thus far.
Okay, and as time goes on, this really does seem to be something that impacts so many people. I know that personally, my parents are dealing with my father's father. I'm sure so many people have the same type of story where just someone is older, they have a diminished capacity, and they need someone to care for them. So let's talk about some of the issues and challenges facing the growing population of older adults with dementia in the U.S. As you said, you are heavily involved in this issue. What are some of the major challenges, some of the major issues that you see facing the growing population in the country?
Yes, I think the demographics tell it all, right? This is almost like a demographic imperative. We know that the population in the United States is aging rapidly, as well in many other countries globally. So for dementia, even though the prevalence, you talk about what percentage of older adults might have this disease, over time, that prevalence may be stable or even go down with better education, better nutrition, better lifestyle. However, think that's the best case scenario. We do hope so. But think about the absolute number of people affected by this disease, simply because the denominator, the number of older people, will explode so many over the coming decades, right? So this is really a demographic imperative. Just focusing on the United States. Right now, we have about 6 million older Americans living with dementia. And the projection says this number will more than double in the next 30 to 40 years. So the care for this vulnerable population will be a huge challenge in years ahead. Many people are cautious about how soon we can find a dementia cure. As of now, it looks like elusive. That's the word used a lot, right? So the question for us, not a clinician, not a drug developer, what can we do to care for the huge number of people living with dementia? That's the care. That's the health care policy. That's how can we improve their environment? If that's something we can do to help improve the lives of these people. So you asked about the challenges. The challenges really, there are so many dementia care challenges. As you are aware, dementia is typically considered as a chronic condition, but it's a uniquely challenging condition, unlike any other chronic conditions, right? You know that, as the example you just mentioned, your loved one experience attest to that, right? Of these people living with dementia, not just have the symptoms, the challenges they have to deal that directly relate to dementia. Often they have multiple other conditions that really requires complex medical care and a lot of non-medical supportive services. That's the challenge. And of course, we know caring for this population is costly. It involves huge cost to the government, public payers, private payers, and families as well. And we will talk more, maybe hopefully in this interview, about the caregiver burdens. As you alluded to, this is huge. Taking care of a person with dementia involves a heavy toll, physically, emotionally, and financially as well, let alone the opportunity cost, the cost to society, right? Because many caregivers, they have to focus on caregiving that takes so much of their energy and the time they cannot otherwise contribute to in the labor force. So these are among the challenges. There are many others as well, as we heard, like there's a lack of access to specialized services for these people. There's stigma attached to this disease. That's also a barrier to effective care treatment. And lack of early diagnosis. There are legal, ethical issues. There are research treatment, deficits. There are also cultural language barriers as well, right? There is a lack of a culturally competent care. So that's, these are many, many challenges illustrated in these areas I just outlined.
Janlian, regarding the issue of dementia itself, let's say you have one person who's 97 years old and is clear thinking, essentially the same that they've ever been, but then you have another person the same age who has very severe dementia. That can be so confusing, especially when you think about a family with that dynamic in their family. Two people of the same age, one has dementia, the other does not. Why is that? Why do some people develop this and others don't? It's not an across the board thing. It does not impact everybody equally. Why is that? Why do some people lose that capability and develop dementia while others do not, even if they're the same age?
Yeah, this is an excellent example that attests to the heterogeneity of this population. Remember, every person living with dementia is different. I'm not a clinician. I don't feel like I have the authority to talk about the scientific basis, causes of these diseases. But I do know this is the variability across individuals that absolutely have to be kept in mind when we think about care for these people. A little sort of a flashback back 30, 40 years ago, just generally speaking, dementia was believed, is misperceived actually as something like related to aging. As you hit the 90s, 80s, you lost memory, you lost some, you needed dependence on activity, daily living, your decision-making processes damaged. Sounds like, just people attribute that to part of the aging, not necessarily seeing that as a disease. The real turning point is in the latter half, maybe the last 20 years of the 20th century. And now, of course, we know a lot better, right? This is a disease. Scientists are still actively researching what are the underlying causes. I don't think we have the definitive answer to that. That's why, the larger point is, this is every person has to be viewed in his own right. In terms of caring for these people, it has to be individualized and care planning, a whole person-centered approach to make it work.
Let's talk about the dementia care policies. You mentioned a little bit about this earlier. How do dementia care policies address the needs of people as the disease progresses? So you look at the policies and taking care of them. How does that address the needs of people as the disease continues to progress throughout the years?
This is a very big question. And I would say the policy focus on this population in this country, in the United States, in many other countries as well, is relatively recent. So as for the reasons I briefly mentioned, right, a long time, this sort of not receiving the needed awareness by governments, by policymakers, by the public as well. Now we have a better understanding of this. This is a disease, right? And it's a slowly progressive condition. So which means the care needs and the preference by the patients with this disease and their family caregivers will evolve over time as well in this long, very long course of the condition, the disease. So, the policies should be designed to help care arrangements, help the healthcare systems to adapt their evolving needs for these people to address them. So which really means, in the beginning, we talked about the challenges, which speaks to the deficits, right? So really any policy should focus on addressing those deficits, like, let's try to improve person-centered care. This is everybody talk about. When you talk about dementia care, this has to be individualized, person-centered, whole person approach, right? That was something relatively rare. You don't hear a lot 30, 40 years ago. And then care planning and the coordination, because of the nature of this disease. The patients not only need medical care, they also need a lot of social care, long-term services and support. That's what I study a lot, right? That is a clinical physician, clinical staff may not necessarily have the linkage or knowledge about it. Even if they do, they may not have the incentive to do it for this kind of a care coordination, management across different other providers and settings. Also, of course, it's obvious, right? Let's increase support for family caregivers. For a long time, this caregiving for people with dementia, like other diseases, right, is sort of considered a family obligation in this country, right? Like alone in countries like in the East Asian countries like China, where I came from, that's the duty. There's no argument, right? You're an adult child, you have to take care of your parents. That's the long thinking. That's a long-standing situation. But a real question is how sustainable that is. It's no longer adequate. We have to think about policies and the supports to help these family caregivers to taking care of these patients. There are other considerations as well, right? Just adding, let's increase access, remove the access barriers to specialized care and services for these people. You have to worry about legal and ethical issues, right? Because these people, they have, they cannot express themselves, especially for those at the later stage of the disease. How can you make sure whatever the treatment you talk about is consistent with their needs, with their preferences? And research and innovation is lacking, but now it's stepping up. That's great. That's much needed. Also, the government, the policy has a role to play in increasing public awareness and education about this situation. And of course, including the end-of-life care for this population is even more challenging, right? So these are just examples, the policies can do to help improve the care system, the care environment, so that make sure they continue to leverage the remaining strength to live an independent life with as much autonomy and dignity as possible.
When you talk about dementia care like that, you do talk about it like a community, like a larger system that all needs to work together to make sure that people with dementia get the care that they need. It strikes me that we just went through a couple of years of the pandemic, and some of these assisted living facilities, they were thrown into a situation that they really weren't prepared for. Everybody had to take these extra precautions. Family members were many times not even allowed to see their family that were in the assisted living facilities. It seems like perhaps the couple of years that we just went through with the pandemic Did it set this whole system back some years that we're talking about now? Did it make it more challenging? What do you think? What was the impact that the pandemic had on this big system, this broad system that you're talking about?
Absolutely. So many people have done research, as time goes by, we have more data, evidence showing how the whole system is just so fragile, is interrupted by this pandemic, right? I wouldn't say this set us back for many, many years. There are signs that we are coming back, but the opportunity indeed is a crisis situation that lay bare all the deficits, right? The shortcomings of this system. You mentioned the word collaborative. That's the key word here for a good care of these people, right? You not only need medical care. As I said, much of this, the big lion's share of the care burden and the cost as well is in the non-medical area, like long-term services and supports, right? So people have the desire, they want to stay at home as long as possible. But at some point, as the disease progresses, many people have to go to the nursing home. That's, that is sort of many people see that as a last resort, unless they have to be there. Is that the best place to be for these people? Not necessarily. A lot of nursing homes, you mentioned assisted living facility, that's slightly different. There's a little bit more residential type of setting. There, the medical presence, clinical presence, even more sparse than in nursing homes. But even in nursing homes, you are absolutely right. This is the tough place for people living with dementia because many facilities don't have the expertise to taking care of these people. You might see some facility, they are advertising themselves, right? We have a dementia care unit, we have a memory unit, but how much they can do often is a question. You don't know much data about it. Maybe just, how much best practice they have the people to do it is always a question mark. Yes, absolutely, this is a challenge. Collaborative care is necessary. How to coordinate, integrate all the needed services across providers, these patients' primary care people, primary care doctors, therapies, social workers, all the whole range of aligned health professionals, and also across settings, right? People living with dementia often, they were hospitalized after discharge, many of them have to go to a skilled nursing facility for a little while, hopefully discharging back home soon, or many of them end up there. So that's the issue. You have to increase the coordination and integration of services across all these disparate places.
And that leads me to our final question, which is about the resources that caregivers and providers can utilize in what they're doing. So if you had to talk about some of the things that are available to caregivers, providers, what resources can they utilize currently?
That's a great question. Let me talk first about on the provider side. I mentioned the lack of coordination, collaboration among the health care providers, right, in all professions. Part of that is driven by how they are reimbursed by Medicare. We're talking about dementia, people living with dementia. The vast majority of them are older adults qualifying for Medicare, eligible for Medicare, right? Medicare does pay this clinical staff for the usual, I would say the usual care for this population. For example, diagnosis, doing some cognitive assessments, right? The regular office visit, evaluation and management, all those type of services. However, as I said, the collaboration part, right? How about the coordination part, you engage with other specialists, other people, the community-based long-term services support providers, assisted living, adult daycare, home health agencies, people. this is out of their purview, right? So they are not receiving separate Medicare reimbursement for this kind of services, which is time consuming, and that sort of make them sort of lacking the incentive to do those kind of coordination work. So that's part of the new CMS model trying to address this. How about let's provide them extra payments to do just this cross-setting, cross-provider care management and coordination that takes their time, that's worth their time, right? So that's just one example. On the family side, on the patient side, the resources, there are different kind of resources. One is, it's sort of finance. We all know that, a majority of these people living with dementia, they will need the social services to help them manage their daily functions, right? The daily activity of living, cooking, moving around, they cannot do that, right? As the disease progresses further. So family caregiver, we talk about family care burden. This is, at the later stage of this disease, this is like 24/7 work, right? And for a unpaid family caregiver, you can only do this much. You will, feel the burden. You make sure you want to, don't be burned out, right? You want to hire somebody to help you, give you the needed break to recharge. How that money come from? Right now, a lot of those is really paying out of pocket. It's very expensive, right? Think about how many families are able to pay to afford such services. The kind of services I just alluded to, right? Having somebody to help you at home, help with the basic personal care. If you qualify for Medicaid, yes, you might be able to receive some of those in the community-based at your home, in the community-based settings. That also depends on whether the states allow those services to provide in those settings. This is an option. This is not required Medicaid services. These are the kind of resources which is lacking, right? And the policymakers should keep working on it, trying to expand access to as many people as possible, not just a small number of the people who eventually qualify for Medicaid. So that's a large issue. Another type of resources is like, I want to draw attention to a very valuable resource RTI International has, which is the National Alzheimer's and Dementia Resource Center, which is based on RTI, staffed by my colleagues, which is funded by the Administration for Community Living. Is almost like a clearinghouse of all the kind of good practices, what works, what doesn't. Our staff provided technical assistance to the administration of assisted living, and the grantees they supported. These grantees are doing a variety of innovative work, trying to figure out what are the best care interventions to improve the care for people with dementia and their family caregivers. So we do a lot of analysis, curate all the resources, what works, for example, producing a lot of webinars, flyers, information, everything is on the website. Just give you a concrete example, right? What if a person with dementia living alone? You can imagine the kind of challenges for these people, right? So, and our people, we search the literature, search the ACL grantees, to marshal the best evidence, what works to help these people around. We produce a lot of, issue briefs, reports, webinars, in an easy to digest format. So this is free for anyone. People can consult the website to find the material that meet their needs. This is just one example closer to where I work. This is a very valuable resource people can check out. Just one example. There are many other resources. The website, the Alzheimer's Association, among many others. there are resources there. There are good practices as well from a smaller scale research or pilots, but it's almost like 100 flowers blooming across the country, right? In the past, in the recent 20-10 years, but more research is needed, more government demonstration projects needed to figure out. Let's try to evaluate. Let's make sure among the best practice interventions, will that work at large scale, right? That needs evaluation before the government can expand access to those programs even more widely and readily to
Absolutely.
more people.
Well, there's some excitement and some hope for the future, it sounds like. And thank you so much for joining us and talking about this very important topic. Zhanlian Feng, the Senior Research Analyst at RTI International. I'm your moderator, Nick Iannelli. For more on this discussion, visit federalnewsnetwork.com and search RTI International.